Here is a goniometer. Keep in mind that the goniometer actually is composed of three different parts. We have an immovable or a stationary arm that's actually connected to the protractor, and then we have the movable arm that follows the motion of the patient. In the middle of the goniometer, where the screw is located, is what we call the fulcrum. The fulcrum is also lined up with the axis. So with that being said, let us begin with our goniometric measuring. Sitting here with Sade, and we're about to measure elbow pronation and elbow supination. And what we're going to do is we're going to actually start by placing the goniometer just proximal to our ulnar styloid, which will be the fulcrum. The stationary arm will stay perpendicular to the floor or the ceiling, and the movable arm will actually follow the position of the dorsal aspect of her forearm. So I'm going to ask her to go ahead and turn her palm down, and then again I just bring this right across, and I don't know if you can see the numbers there, but we are roughly at about 75 degrees, keeping this parallel, or excuse me, perpendicular. And the numbers for pronation that we're looking for are 75 to 85 degrees, considered normal. Okay, I'm sitting here with Sade. She's in a neutral position, elbow flexed at 90 degrees, hand in a neutral position. We're about to measure what's called supination, which means that's the rotation of the palm toward the ceiling. I'm going to actually place my goniometer so that the fulcrum is on the volar side, but finding the ulnar styloid process just proximal to it. And what I'm going to do is I'm going to keep my stationary arm perpendicular to the ceiling or to the floor as I ask the patient to turn her hand toward the ceiling, and then I come across at the area that's most level. It's very important that she stays stabilized and that I stay perpendicular so that I get the best measurement. And just so that you can see here, it's backwards, but if you read that, that's actually 80 degrees of supination, and our normative data for supination is 80 to 90 degrees.